Good afternoon. It's been several weeks since our last press conference, and I'm glad to be speaking to you after what I hope was a safe and enjoyable Liberation weekend for all. I would like to begin by thanking all islanders for your continued commitment and adherence to our public health guidelines, and we continue to see high levels of compliance and very low rates of COVID-19 transmission in Jersey. We should take pride in the good position we find ourselves in. And because of your efforts, now's the time to further relax restrictions, to reconnect our island community, and to look forward to the summer that we all want to share. And I'm pleased to announce the following changes to our safer travel policy, which was reintroduced for inbound travellers from the UK and other Crown dependencies last month. Firstly, following deliberations from STAC, the competent authority ministers have agreed that from Friday the 28th of May, we will begin our red, amber and green classifications for the rest of the world, aligning them as closely as possible with the UK's traffic light system. We will also introduce national classifications for England, Scotland, Wales, Northern Ireland and the Crown dependencies. We will be changing the testing requirements for green arrivals. From the 28th of May, they will be tested on arrival and again on day 8. And those travelling from green jurisdictions will still need to self-isolate until their first negative test result. And the testing and isolation requirements for amber and red arrivals remain unchanged. We've been able to make these changes thanks to the good position that Jersey finds itself in and given the strong vaccination rollout in the UK. Revising our classifications will simplify travel to and from Jersey, and I hope this will give greater clarity to islanders who are looking to travel off island and receive visitors. Based on the current case data, England, Wales and Scotland will be classified as green, and Northern Ireland would presently be rated amber. But we anticipate the downward trend of cases to continue across the UK, and we will continue to review and publish updates to these on a weekly basis. I can also confirm that there will be special provisions for those travelling from the United Kingdom who have been fully vaccinated, and I'll be asking the Deputy Chief Minister to outline those in just a moment. This will form part of the COVID status certification, which will begin to roll out as soon as possible after the 28th of May. I'd like to reiterate my thanks to islanders. These latest relaxation is only possible thanks to the strong take-up of our vaccination programme and the low rate of cases seen both locally and in the UK, and this is your achievement. Thank you for your continued cooperation, and I'll pass over to Lyndon as Deputy Chief Minister. Lyndon.
Thank you, John. Like many islanders, I was delighted to see families reunited when we reintroduced our safer travel policy 2 weeks ago, and I hope that these next changes will allow for even more islanders to travel and to see friends and loved ones. These changes announced today will also provide clarification for islanders and visitors, enabling them to plan ahead with confidence and to book a visit to Jersey for the weeks and months ahead, in the knowledge that they can do so safely. Given the exceptional progress that continues to be made both in Jersey and the UK with the vaccine programme, we will be introducing a green light status for islanders and visitors returning from green and amber regions if they have been fully vaccinated against COVID-19. This green light status will apply to travellers who have received both doses of an approved COVID-19 vaccination, with the second dose having been received at least 2 weeks before arriving in Jersey. Passengers applying for green light status will have to confirm prior to arriving in Jersey that full vaccination has been received. They will do this when completing their travel declaration. On arrival in Jersey, green light passengers will be asked to present a recognised form of full vaccination proof in either paper or digital format, and further details about this will be confirmed in the very near future. The green light status will permit fully vaccinated travellers to avoid any isolation but they will still be required to take a single test upon arrival. We are taking these proportional steps to minimise the disruption to people's travel where it is safe to do so. And these changes will allow for fully vaccinated travellers to visit Jersey within a tailored testing regime that reflects the reduced risk that they pose. Reconnecting our island and encouraging visitors to Jersey will not only enable families and friends to be reunited, but will also provide a much-needed lift to our island's economy, and especially our tourism and transport sectors, who have faced immense challenges over the past year. Our safer travel policy means that we can safely welcome back visitors to our island and promote Jersey as a safe and attractive destination once again. I would also like to thank Islanders for supporting the recovery of our local hospitality sector and for their engagement with our Do It for Jersey staycation campaign. So please do continue to support this campaign as we move into the summer, so that we can retain our essential tourism infrastructure as we continue to emerge from the pandemic. I will now hand over to the Health Minister to talk more about our vaccination programme and the changes to our public health measures. Thank you. Richard.
Thank you, Chief Minister and Deputy Chief Minister. Keeping islanders safe and well this summer remains a key priority as we continue to reconnect locally, nationally and globally. Having reviewed the risks for moving to national classification for travel, ministers are confident that our safer travel policy, alongside other on-island measures, including our vaccination programme and testing programmes, are strong and robust. Islanders can be reassured that in combination, these measures will help to prevent the risk of spread of COVID-19 in our community. The success of the vaccination programme is testament to the shared values we hold of keeping each other safe and allowing our community to once again thrive during reconnection. As of today, 43% of adults aged 18 and over are now fully vaccinated. And importantly, that includes islanders who are the most vulnerable and most at risk. We work closely with the UK, which also has a very similar successful rate of vaccination, and on which we rely for our supply of vaccines. It is partially due to this shared success that we can move to national classifications within the UK and Crown dependencies, with allowances for those fully vaccinated. We are on track to have completed our vaccination rollout by August, with vaccines being offered to everyone over 18. Those aged between 35 to 39 are now able to book, and I really do encourage everyone who is eligible for vaccination and has not yet been vaccinated to do so. The weekly updates from the vaccination team always come as encouraging news, but the vaccination programme was never designed to be a standalone intervention. With all types of virus, there must be a range of actions that work together to control infection and protect people. And in this respect, COVID-19 is no different. Another vital area of work which protects the island is our expanded testing programme, which now covers arrivals, symptomatic people, direct contacts, vital services and frontline staff, as well as community testing within businesses, schools and care homes. The community testing programme for selected business sectors will protect employees, customers and visitors over the summer months and support businesses remain open. The rollout of lateral flow testing to retail, hospitality, transport, early years, cosmetic, agriculture and other sectors acts as an important measure to isolate any cases and break chains of transmission. So I say thank you to those businesses who've already registered on the community testing programme, which is to launch next Monday, 17th of May. Businesses not yet registered can do so by visiting gov.je. As we progress with the reconnection roadmap, supported by public health guidance for the steady easing of restrictions to gatherings and events, preventative measures are still an important tool to also reduce the risk of spread. We encourage all islanders to follow good ventilation practices, such as opening windows, which can be used as a key tool to reduce risk within workplaces, homes and all other indoor spaces where people meet. Current mask guidance remains in place, and social distancing of 2 metres where practicable, but nevertheless never less than 1 metre, should still be observed. By maintaining good practices and by taking advantage of the opportunities offered through vaccination and testing, alongside these new changes to the safer travel policy, we can all look forward to an enjoyable summer, with safety being at the heart of all we do. I will now pass back to the Chief Minister. Thank you.
Thanks, Richard. I hope the changes we've announced this afternoon will come as welcome news to islanders. They've been designed as proportionate changes to our safer travel policy, which will help facilitate a summer where islanders can safely go abroad and visitors can arrive in Jersey with appropriate controls in place. As always, we'll be keeping all of these measures under constant review, and we will react quickly if the need should arise to change them. I'm now going to invite questions from the media, and for the first time for a very long time, we've actually got people in the room with us as well. So good to see everybody in physical form. So we've got Gary with us in the room. We've got Richard in the room with us. I think we've got Charlie, I think it is, on JP, hopefully. Hang on. Elodie for Bailiwick, and Harry from 103. And we'll go down the usual cycle in 2 questions each, and as we've got people in the room and online, we'll hop between the two. So, Gary, would you like to kick off first?
Lovely to see you all face to face again. I tweeted earlier this morning that something like this was expected to be announced today, and actually the key pushback I've had from people is a concern about the vaccination not reducing transmission of coronavirus, and indeed about new variants. Now, I can give the evidence that I can look from official sources, but I wonder, Dr. Ivan Muscat, given you're here and you probably know an awful lot more than me, for people who are concerned right now that you're doing too much too fast and relying on this vaccine, we've seen what's happened in India and other places as well. What do you say back to them?
Thank you, Gary. Vaccines help prevent transmission in 2 ways. One is if they protect you in the way that they're meant to and do against catching infection, then of course you can't transmit it because you haven't got the infection in the first place. So if the protective efficacy of 2 doses of, say, Pfizer or AstraZeneca is 90%, then you already can't transmit the virus in 90% of cases. Additionally, however, because vaccines are not perfect and do not provide perfect protection, where infection does happen despite vaccination, they prevent onward transmission by 50%. So let's say 100 people have been exposed to infection. If they have all been vaccinated, 90%, 90 of them will not transmit infection because they're protected. Of the remaining 10, 50%, even though infected, will not transmit infection. So that means that only the remaining 5 can transmit infection. That sort of type of thinking has come from studies involving healthcare workers in Scotland, more than 100,000, looking at the risk of transmission to household contacts. And the 50% drop in transmission was based on 1 dose, not 2. Additionally, Public Health England have recently published data looking at 57,000 household contacts, and the drop in transmission after 1 vaccine, not 2, was between 38 and 48%. So that fits. So with 2 vaccines, you're even more protected. That's the transmission side. Then there is the acquisition side. If the people you're trying to transmit to are also vaccinated, then that 5% that are trying to push infection onto others will be rebutted by the 90% protection against infection that doubly vaccinated recipients of vaccine would have. So there is a huge, huge benefit from vaccination, which is why it is so terribly important that all those that are invited to go for vaccination do so.
Chief Minister and Deputy Chief Minister, on the business side of all of this, I reported a few weeks ago, and I've heard it from very reliable sources, particularly EasyJet, but also Jet2 were saying, look, if you guys don't pull your fingers out and make this simple before the end of May, we're leaving Jersey. Just give us an insight into how big a threat that was.
I don't like the word threat. There's been a concern.
Okay, reality.
Yeah, there's a concern. The concern is that in the context of low rates generally, good vaccination program, you're then getting to that wider thing about overall well-being, and that includes economic well-being. The well-being side, if that makes sense. There's a lot of people over here who particularly have family elsewhere, a lot in the United Kingdom, so therefore that ability to reconnect. I was speaking to somebody the other day who hadn't seen their mother for 7 months. There'll be lots of those kind of examples. You saw the fantastic photographs in the JP when we first opened up. It's that type of thing, and that does improve well-being, if you like, for islanders in the context of low rates. The other side is, if you go back to what feels a long time ago, 2019, we were blessed with 8 flights a day coming out of Gatwick alone. So that connectivity, both for islanders in terms of the ability to easily go backwards and forwards, is important, not just for business, but then obviously economically is important as well, and that is definitely well worth taking into context in the context of where we are on COVID. And to give an example, I'm glad you asked that question actually, on the sheet of paper I've got in front of me, 12th of April 2021, we had 556 people coming in that week. 15th of April 2019, we had 18,000. So that gives an indication of the change in travel. And obviously what we are trying to do as part of the reconnection programme is to eventually get to living with COVID and getting back to as normal as possible. That gives you the context. Lyndon, do you want to add anything else?
I just wanted to add that the airlines are keen to fly to Jersey and prepared to fly to Jersey, and it's a fluid position, and they will put on capacity in line with demand. But the restrictions we have up until the 28th of May have proved to be a deterrent to travellers because of the 3 testing, some confusion about what regions they were in, how they qualify which regions they were in, and that was a great disincentive to travel. So have we not only seen new bookings, we've actually seen a lot of cancellations for May. So hopefully that will reverse that trend, and if we start to see more bookings for June with the new policy, then the airlines will put on the capacity we need.
Thank you both. Thank you all. Sorry, Dr. Ivan as well.
Right, we'll go online. We'll go to Charlie first at JP.
All right, thank you, Ministers, and thank you, Dr. Muscat. I was interested to know why you've moved away from a local authority and lower tier authority approach. For example, Glasgow is very different to Shetland, or Cardiff is very different to Pembrokeshire, even though the case rates are generally low across the UK at the moment.
So in the context of falling rates generally, we had some choices between regions and country status, but actually, again, as we keep learning from this, as I said, in the context of falling rates and good vaccinations, it was felt appropriate that we could go up to the country level, because it is a lot simpler. But it is something also we will be continuing to monitor, etc., all the way through the summer. We're keeping the regionalisation both for Ireland and for France, given the the different levels of rates and the different levels of vaccination we're seeing. So this is purely what we call common travel area, excluding the Republic of Ireland for the time being, and mainly because, as I said, we're seeing good rates out there, and it's simpler to keep it at the country level if we can. Do you want to go for a second question?
Yeah, that's great. Thank you. Why have you announced a vaccine passport scheme before everyone has been offered at least a first vaccination? I think it was said that 43% of islanders have been fully vaccinated, but that means that almost 60% aren't. Does this discriminate against younger people?
No, we've been going through quite a lot between the ethics and etc. and all those type of dilemmas, and I'll hand over to either Richard or Ivan, whoever wants to arm wrestle on that particular matter. But I think what you've got to remember, this is facilitating. So it is about giving people who have had 2 jabs the ability to, if you like. There's everybody else will go through the existing system, but if you've been double jabbed. What we're saying is we might as well, we're at that point, we can start recognising the benefit of that. So it's not a discriminatory system. Everybody's, if you like, everybody's been treated, everybody has the same access. Some people have got a simpler access, but everybody still has to be tested. And this is really just as a simplification for those who've received the double jab. But it is a recognition that this is going to speed up rapidly. Don't forget as well, the earliest it'll be is from the end of May. More people have been vaccinated by that point. We're expecting low levels of travel in June, so again, more people will be vaccinated and double jabbed through June, and then obviously leading up through the following months. Anybody want to touch on the other deliberations?
By the end of May, we anticipate that most people down to the age of 30 would have been offered at least 1 dose of vaccine. So that we need to bear that in mind. You can also, of course, turn it on its head in a sense and say, well, should we not offer the benefit of double vaccination to people aged 30 to 80 plus, because we haven't yet vaccinated the under 30s, and that doesn't quite seem right either. So allowing the benefit of double vaccination to those who have been doubly vaccinated, and of course continuing to do so as we go forward, seems like a reasonable approach at the moment. Vaccination is continuing apace, obviously.
Okay.
That's great. Thank you.
We'll do one more online, then we'll come back in the room, and then we'll finish off online. So, Elodie.
Hi, good afternoon. It's probably a question for Dr. Muscat. We know there have previously been disagreements between STAC and ministers over the loosening of travel restrictions. Was the new system drawn up by STAC or ministers? And was STAC supportive of both the easing up of testing for double vaccinated passengers and the removal of regional variations in the UK?
In STAC, there is always a lot of discussion, and there isn't always necessarily a consensus, but there may be a difference of opinion, but usually with a majority view one way or the other. And that advice and thinking about the evidence is what is presented to ministers, and it is ministers who make the final decision based on the discussion and thinking that has gone on in STAC, which is of course based on the evidence available to STAC. So, for example, some of the thinking that went into the lower tier areas was we base that on where people have slept, but you don't necessarily work just around the corner from where your house is. You can work in another tier. The rates of infection in the UK are going down. The last SPIMO publication issued last week indicated that on average in the UK they're seeing between 2,000 and 9,000 new cases per day across England. Now that England, of course, as you know, has a population of 70 million. So if you say 7,000 new cases a day, then that's one case per 10,000 people per day. So to put the what would otherwise look like a large number into perspective. So we bore that in mind as well, together with, of course, the increasing vaccination rates in the UK, which are on par with ours. We get 0.7% of the vaccines that they get, so we're working with them hand in hand, if you like. And the simplicity of a national scheme or a larger regional scheme was also very attractive. So putting all that together led to the conclusion that it is perfectly reasonable to go for something bigger than a lower tier system.
Second question?
Just to clarify on the first one, was it the STAC idea, or was it an idea from ministers that STAC agreed with?
We were asked to look at safer travel as a whole. And one of the elements that was needed to be looked at was whether to continue with lower tier, upper tier, regional or national levels. And what I was just saying a few minutes ago includes many, perhaps not all, because I can't remember them all, but includes many of the items that were discussed at STAC.
Okay, second question?
Yeah. My second question is probably for you again, Dr. Muscat. In light of the changes to the classifications, have any efforts been made to ramp up testing for variants? And we will be able to get a quicker turnaround for the test than we previously saw, as of thinking of December, for example, when we took weeks to have the results on the samples that we had sent. Okay,
so there are many interrelated parts to the answer to that question. The first actually helps complete the question Gary posed, which was vaccination and variants. The current vaccines that are available to us, Pfizer, AstraZeneca, and the Moderna to a lesser extent, all cover the Kent variant. And to date, everyone is saying that they will also cover the Indian variant as well. We do in our safer travel policy have an emergency brake, so to speak, or a red card, which basically means that if we note that there is an increase in the number of variants of concern in a particular part of the UK, such that it's led to surge testing over there, then we would apply the emergency brake to entrance from that area to Jersey in order to safeguard Jersey. We would also be looking at an emergency brake in relation to higher numbers of infection. So higher numbers of infection may be due to a new variant, for example, that is more transmissible than the previous variants. So we would bear that in mind as well when thinking about our emergency brake, because as you know, there are two variants, if you like, in a sense, variants of concern that you already know about, and emerging variants that you only work out are variants of concern after the event. And the increasing numbers of infection will tell us that. Finally, we are seeking to expedite the sequencing results we get from viruses in Jersey. And last week we had discussions with a particular provider with a view to getting results for S variants, those variants in the spike genes, within 48 hours or so of sending them away.
Okay. Okay, back in the room. Richard.
Back in the room. Thank you, Ministers. Thank you, Dr. Ivan. It's a great thing to see on the 29th, that map of the whole of England turning green. That's going to create a lot less confusion for travellers. What mechanisms, you mentioned just now the red light system, but obviously we have things flash up really quickly. We've got an issue in Bolton at the moment. How long will it take before that red light issue gets triggered? In other words, how confident can people be to book a holiday weeks before, or a week before? It's almost like we're in the same position if that red light system can just come on in an instant.
In the same way as an emergency brake can be applied in an instant in sort of day-to-day life, and that's what it's there for. So this is about approaching COVID essentially in the same way as we always have, balancing the safety of the population of Jersey with the freedoms that we wish the peoples of Jersey and their relatives and tourists and so on to enjoy. And this is perhaps the one way of doing it without inhibiting too many freedoms.
Thank you.
I think it'd be fair, it'd usually be a concern if it was a variance issue, I'm guessing would come through. Usually I think you get a little bit of a warning coming, generally. But also it does mean then that you're not going to be caught out by fractional changes, because actually, also for the sake of argument, somebody's doing increased experimental testing in there, which can sometimes push the numbers up when actually the risk hasn't changed. So by spreading it across on the country basis, that it does smooth things out. But we do need that. You need that ability to be cautious, but overall it should give greater certainty to people.
Thank you. And we've got obviously a green UK coming up. We do have other countries that are going green that we can pretty much offer direct flights to, like Mallorca and things like that. Will you apply the same rules to a green country on a direct flight after the 29th of May?
I'm going to point towards Lyndon actually on that one, because as we are trying to align mainly with the UK one, although we have allowed variations for the type of circumstances you're talking about. It will depend on the circumstances.
Okay, thank you, John. So the red, amber, green system will apply to international travel. Prohibited countries, countries prohibited by the UK will be prohibited by Jersey. Anyone coming from a red area will have to isolate 3 tests and until they've received 3 negative tests. If you have received a vaccination in Jersey or the common travel area or the UK, the vaccination on entry process will apply. If you haven't, then you come from an amber area, you would isolate in line with that procedure. If that makes sense.
Yes, I was more thinking, let's say that we had a direct flight from Spain, from Mallorca, straight into Jersey. Does that mean if it's a green country, your vaccine passport would work, your green light system would work?
Yes, if it's issued in the common travel area, as I currently understand it. So for Jersey people who've received both vaccinations returning from Mallorca, they would just require 1 test on arrival, no isolation. People who haven't received vaccination yet coming back from Mallorca would receive 1 test on arrival and 1 test on day 8 under the current rules, but would require to isolate until they received their first result.
That's lovely. Thank you very much.
Richard, do you want to add anything?
Well, yes, just to add, if we're talking about people who are not resident of Jersey coming to the island from Mallorca or any other green area, they can't at present avail themselves of that vaccination status and have that different treatment. But there's a lot of work going on internationally and involving the World Health Organization to try and set up some form of call it a COVID status certificate, not a vaccination passport. And that's being worked through. Jersey's getting involved in those discussions too. So it may happen later in the summer. And of course, later in the summer, a lot of people, most of the population, at least in the UK and Jersey, will be vaccinated and may well be able to take advantage of that status. Thank you. And
with the CTA, Common Travel Area, the point is that even if a digital solution isn't actually available from the date, that's why we're saying we want to get it in place as soon as possible, as close to the 28th, allowing for iterations that sometimes come through. It is likely to be possible that we can just accept some form of paper documentation just to start that ball rolling, and hopefully ultimately we'll end up with a digital solution. But we also want to make sure that works, and A, it works, but B, can then is capable of being expanded to cope with other international standard as and when it arises. So that's that starting point.
Oh, gentlemen, thank you very much. Thank you.
Right, I think Harry comes to come in.
Yes, good afternoon. You mentioned the vaccine uptake's been very good. We've got one known active case. So for arrivals from Green, obviously they don't have to do 3 tests anymore from the 28th. They just have to do 2. Why couldn't they just do 1? Green is obviously green because it's a low risk. Why can't they just do the day 0 test? And if it's good, they're on their way. Why do they have to do 2 tests? Because green is a low risk, isn't it?
Do you want to come on the efficacy of the 2 tests at all? Whoever.
We're obviously trying to minimize risk, whatever that risk is, whether it's directly COVID related or indirectly. The day 0 test picks up 60% of incoming infections, bearing in mind that the incubation period of COVID is up to 14 days. So if you catch the infection 2 or 3 days before you land in Jersey, your day 0 test is going to be negative, but your day 5 test is going to be positive. Obviously, you'll be out and about between day 0 and day 5 if you've come from a green area, because you only need to isolate overnight if you haven't been vaccinated. But at least we would then know that you're positive, and we will be able to undertake contact tracing to reduce the risk of any outbreak. That risk, of course, has now been diminished by the vaccination program, but that risk has not been reduced to 0. So we still need that contact tracing.
Sorry, just to clarify then, so why is it day 0 and 8? Why not day 0 and 5?
So partly because day 8 falls somewhere between 5 and 10. So as you know, our regime is to date has been days 0, 5 and 10. You will probably capture most of the infections coming into the island by doing a day 0 and day 8. And that way, instead of bringing people back in for a 3rd swab, you just bring them in for a 2nd swab.
So I suppose there's a recognition that green is less risky. Therefore, we're recognising that, particularly in the context of greater vaccination levels here and in the UK, and therefore it's appropriate to change the green regime. As we said for everywhere else, when we do go to red, amber, green, it's going to be red, amber, green, and what we talked about for the amber and the red particularly. Okay.
Thank you. Can I just ask, I mentioned we've got 1 case, vaccination levels are going well. A lot of people welcome the fact that children and staff in schools don't have to wear masks in the classroom anymore. I think a regular topic of conversation on our social media pages has been, why, given the good position are we in, are we still being made to wear masks in public spaces? Can you justify and explain why we still have to do that?
Richard, do you want to go?
Well, yes, and if Ivan can help with any scientific evidence. So, as Ivan said in answer to the last question, there is still an element of risk, and it's important that we are cautious in the way we interact. Where we have to wear masks, they're not controlled spaces in the way that schools are. People can get very close to each other. So that is a position which is constantly being reviewed. But at the moment, the advice that I'm getting is that mask wearing should remain and is an effective way of ensuring that we keep the island safe. But I'll pass over to Ivan if he has anything to add.
I completely agree with what the Health Minister has said, and certainly we are monitoring not just the COVID activity, but also the elements of mitigation that we have, and on an ongoing basis, trying to make sure that we match the two. What we do need to bear in mind in that exercise is that with increasing reconnection, with increasing fluidity of movement of people, there is an increasing risk of spread of virus should it happen to be present. So we do want to give ourselves some time to observe the effect of a particular loss of a mitigation factor before we move on to another piece of reconnection. So because it takes, as we were saying, about 14 days for infection to show up after transmission.
Okay, we'll try and do one question left each. Oh, sorry, Lyndon, you want to say something?
No,
yes.
If I could, I just wanted to say, and I'm sure I speak for many islands, I can't wait to see the time when the masks are not compulsory any longer, and that can't come soon enough for many of us. But I think the point is that as we're increasing our reconnection with visitors, it is worth just hanging in there with them a bit longer. And hopefully when we've had a period of time when we've seen hopefully the positive effect of the vaccination programme, and whilst we're having visitors and islanders travelling again, if the cases remain low or non-existent, then I hope it's in the very near future, or not too distant future, the Health Minister and Dr Muscat will be saying it's all clear and we can bin them.
Yeah, good luck. Okay, quickly, we'll do, Gary, one short question, and then whiz round the screen. We'll finish up with Richard, and then we'll call it a day.
Don't worry, well up for a quickie. I've got to edit my report for 6 o'clock, ITV Channel Television, everybody. If the international map now doesn't kick in here till the 28th of May, but it's in place in the UK from the 17th of May, Madeira from the 17th of May to the UK is green, Madeira to Jersey till the 28th of May is red. In that 11 days, people are going to get caught out. I'm already having messages about Madeira. What can you say?
We'll take that away and have a look at it and just and come back to on that one. I think it is sometimes the difficulty of trying to do connectivity in one area, and there's sometimes you get these anomalies that come through. I don't mean anomaly in a derogatory way, it's just that sometimes these happen. We'll have a look at it and see if there's anything else we can do, but I think we've just got to cope for 2 weeks. It's before the half-term break, and then we'll be consistent.
Okay, but you'll give us an update on that, because I think people will want some clarity on that 11 days.
We'll give some updates.
Specifically about Madeira, not every other place on the planet.
No, that's okay. We haven't allowed for connections, but we basically said, look, the crucial thing at the moment is get the CTA because of the vaccination levels. That's probably one of the big factors, and within the European context as well. But okay, we'll take that away.
Thank you. That was my quickie. Cheers.
Okay, right. Online, Charlie.
Right, thank you. You might have already answered this, but when can islanders expect a Jersey app that will be able to show their vaccination status?
I think the short answer is that we're trying to work on it. Teams are being put in place, but the crucial thing there is making sure it talks to the relevant, starting with obviously United Kingdom, but also understanding as and when you get an international standard. That's the challenge. And to an extent, that's one of the reasons we're saying actually first stage is let's actually get something working, i.e. even if it's paper, to actually allow the benefits to come through sooner rather than later, rather than waiting for the technology to catch up. It's being worked on. I don't think we've got a definitive date, unless Lyndon's going to update me.
Well, I'm not going to give a definitive date, but officers are working with Digital Jersey at a digital solution.
Yeah.
But rather than wait for a digital solution and that delay anything, we'll start with accepting appropriate recognised paper proof.
We've just basically tried to take a practical approach, essentially, to allow it to come through. Okay, Elodie.
Yes. Are you able to tell us, I don't know which of you would be able to answer that question, but can you tell us how many businesses have registered to take part in the weekly lateral flow test regime since it was announced at the beginning of the month, and how many workers does that represent?
Any information, or is it one we have to go back on?
Can we come back on this?
Okay, we'll come back to you on that one. Don't have the data in front of us. Okay. Just to, only because I know it's Ivan's favourite topic, because I keep putting his leg about it, we're also doing what I'll call community testing at a larger scale, because obviously that's the sewage testing and stuff that will be coming down through Belazan, which is also about giving an underlying indication, and they're working on getting that in play. I'm not sure, Ivan, when those results eventually, when that, if he actually started, or is it about to start? I can't recall.
So the COVID is also excreted through the gut and therefore finds its way in sewage. And there are systems that allow for analysis of effluent to see if COVID is there. And it can pick up 1 in 10,000 individuals with COVID, if you like. So if one individual in an area with 10,000 people in it has COVID, it will be picked up. So it's very sensitive. Additionally, you can sequence it as well. And we introduced it with in Jersey via environmental health 2 weeks ago or 1 week ago. The first samples were sent off. We haven't got the results yet, but we anticipate them shortly, and we will be getting results, monitoring results on a weekly basis going forward. Additionally, we will have stored samples frozen down to -70 to go back to analyse further should we need to do so. And starting where we are now is a good place to start because of our very low baseline levels. So if we see those levels starting to go up, it will start to tell us that something is happening in the community and we need to be perhaps a bit more cautious, undertake more testing and so forth. So it's yet another tool, not the only one, of course, but another one.
So it's a layer in the defence, if that makes sense, we're introducing. Okay, Harry.
Thank you. People will be very keen to go on foreign holidays if they can. Maybe France, for an example, this summer, but some areas of France might be red on the traffic light system. Do you advise people against going on holidays to these sort of places, or is it a case of you can go, but you just got to do the 10 days when you get back?
I think at this stage, let's focus on the CTA. Let's see where we get to the end of the month. Let's see what the vaccination programme is looking like. Europe is saying they're going to be accelerating. We'll take all that into account. It's a little bit early to start commenting on that, I think, at this stage. Okay. Okay, Richard.
Thank you. We're noticing in the UK that Boris is telling people they can hug again, which is a wonderful thing, I must admit. What is our stance on that?
That's a very good question. I'll hand it over to the, I was going to say the Minister for Hugs, but the Health Minister.
Minister for Hugs. Oh, that'd be lovely. We've gone through a period where we've all had to stay apart from each other, and the advice is that it's still important to maintain your distance, that it is a measure that helps control any possibility of spread in the island. So, of course, within families, within households, we can hug, and that's great. But the advice would be, I'm afraid for the moment, Ivan, still to keep that minimum of a 1 metre distance. So that's for the good of the island to guard against any outbreak, which we certainly don't want to see this summer.
So a hug with strangers from a distance. Thank you.
Thanks very much.
Thank you.
Okay. Right, I just want to close this particular evening by just thanking the members of the media. It's very good to see everybody in the flesh for their questions, and for thanking all of you for joining this press conference. We continue to make good progress both in our vaccination programme and in our broader reconnections, and this is only possible with your support and cooperation. Now, on a subject separate from COVID, next week we're launching the first in a series of new streaming events to improve our engagement with you. And this is building upon the success we experienced with our virtual parish hall sessions during the government plan last year, and it will give you the chance to put your questions to ministers directly, and we also hope will give a better understanding what ministers and government do. And the reason I'm looking that way is because the first event will be hosted by Gary Burgess, and more information, who was squirming at that point, and more information will be available on the government's social media channels in the coming days, and you'll be able to follow the event online via Facebook, Twitter and YouTube, and I hope you will join us there. Thank you for listening, and good afternoon.